Hello, first I would like to thank you for reviewing my presentation. My name is Heather Ross and I will be presenting information on the DNP Prepared Nurse Executive Leader. What exactly are the responsibilities of a nurse executive leader? What competencies do nurse executive leaders possess? What makes the DNP Prepared Nurse qualified to hold this position? What are the benefits of having a DNP Prepared Nurse hold this role? What are the gaps in the literature regarding this role for DNPs? And what further research needs to be done? How do we continue to implement and increase the number of DNP prepared nurses into this role of nurse executive leader? I will address all of these topics at the end of my presentation. My hope is that you will understand the value a DNP prepared nurse can bring to the nurse executive leader role. What is a nurse executive leader? They are a senior level administrator who oversees nursing operations in a healthcare organization. Titles may include Director of Nursing, Chief Nurse Executive, Chief Nursing Officer, or Chief Executive Officer. Responsibilities include leading nursing teams, guiding nurse initiatives, ensuring safe, high-quality healthcare delivery, following evidence-based practice, managing finances, and making decisions that align with the goals of the healthcare organization. A nurse executive leader brings the perspective of nursing to the hospital boardroom. Nurses are the largest component of a healthcare organization and deserve to be represented by an expert nurse. According to a study by Sunding and McGrath in 2016, only 5% of nurses hold a seat in hospital boardrooms. A DNP prepared nurse is well qualified for this role. The DNP nurse executive leader must be competent in several areas, including nursing and business principles. These include organizational and systems thinking, health information technologies, political intelligence, quality improvement and evidence-based practice, business principles, communication, collaboration, change implementation, problem solving, patient safety, patient and staff satisfaction, health policy, finances, and they must be able to balance clinical practice with financial budgets. The DNP curricula ensures the graduate is an expert in all of these areas. This is supported by the AACN's Essentials for DNP Education. 4 of the 8 essentials are applicable to nurse executive leaders. They are Essential 2, Organizational and Systems Leadership for Quality Improvement and Systems Thinking. Essential 5, Healthcare Policy and Advocacy in Healthcare. Essential 6, Interprofessional Collaboration for Improving Patient and Population Health Outcomes. And Essential 7, Clinical Prevention and Population Health for Improving the Nation's Health. The benefits of employing a DNP graduate in the nurse executive role include the ability to inspire and lead others. They are capable of practicing in the clinical and business setting. They bring the perspective of nursing to the executive level, and they are well positioned to lead nurses and organizations to success. The DNP prepared nurse has the qualifications and diverse skill set to fill the role of nurse executive. Although the MSN degree is acceptable for a nurse to practice in an advanced role, additional skills are needed to keep up with the evolving, intricate healthcare landscape. The AACN Essentials for MSN Education requires graduates to only have an understanding of healthcare delivery, systems, and organizational thinking, economics, and change theory, while the AACN Essentials for DNP Education require graduates to be experts in those aforementioned areas. DNP curricula builds off MSN education, making the DNP graduate more robust in several areas necessary for executive leadership. The DNP Scholarly Project also ensures graduates are experts in these areas by satisfying all of the AACN essentials for DNP education. While there are MSN programs with a concentration on nurse executive leadership, the DNP degree requires more practicum hours and more successful credit hour completion, making the DNP a more ideal candidate for a nurse executive leader role. Beyond advanced degrees in nursing, candidates for nurse executive leadership roles may include those who obtain graduate degrees from other disciplines such as health administration and business administration. Although it is a dated study, I found a study conducted in 2013 by Swanson and Stanton that found only 13% of chief nursing officers believed the DNP degree should be the recommended advanced degree for nurse executive leaders, while 65% felt other advanced degrees were sufficient. Another study in 2015 by Aldous and Mancuso found that a majority of nurses thought DNP-prepared nurses were well equipped to influence and create change by assuming leadership positions. While these studies are dated, I found the results interesting. I imagine as the number of DNP prepared nurses have grown over the last 10 years, perceptions may have changed. A SWOT analysis was conducted to identify the strengths, weaknesses, opportunities, and threats of the DNP nurse executive leader. Strengths include that DNP is an expert in systems and organizational thinking. They are able to balance clinical and business practices. They are equipped to succeed in complex healthcare environments. They are competent in leading to improve patient outcomes, improve the patient experience, improve population health, all while reducing healthcare costs. Weaknesses include that there is a lack of knowledge by organizations on the differences between a DNP and an MSN prepared nurse. The DNP degree is still a relatively new degree, and there is a scarcity of DNP specific positions. Opportunities for the DNP nurse executive leader include the ability to raise expectations in nursing leadership, the opportunity to improve clinical responsibilities with leadership responsibilities, and the opportunity to increase the knowledge of the value of the DNP prepared nurse. The American Organization of Nursing Leadership found that in 2024, the top 3 challenges nurse executives are facing are staff recruitment and retention, availability of financial resources, and workplace violence. Threats of the DNP nurse executive leader role include candidates with advanced degrees outside of nursing and candidates with an MSN degree with a concentration in nurse executive leadership. A PEST analysis was performed to evaluate any current or potential external influences that affect political, economical, social, and technological factors. Political influence include federal and state regulations that affect an organization's financial health, federal and state laws that affect healthcare delivery, implications of federal and state regulations on nursing, and current leadership infrastructure in a healthcare organization. Economical influences include annual operating budgets, available financial resources, healthcare business models that align with the organization's financial goals, and financial implications of current clinical practice. Social influences include diversity in the workplace, organizational cultural competence, interdisciplinary collaboration, and community involvement. Technological influences include the use of technology that improves clinical practice and finances, technological trends that enhance patient care, and necessary leadership in the adaptation of new technology. There are gaps in the literature regarding the value of the DNP prepared nurse in the nurse executive leader role. There is a lack of knowledge amongst healthcare organizations about DNP preparation. There remains a limited amount of DNP prepared nurses and a scarcity of DNP specific positions. The advantages of employing a DNP nurse executive leader is still not clearly understood. A survey by AACN in 2022 revealed only 10% of graduates had advanced their career to the nurse executive level. So what research needs to be conducted to help close these gaps? Further research needs to be conducted to understand the effects of the DNP prepared nurse executive leader on patient and organizational outcomes. We need to identify measurable outcomes of DNP nurse executive leaders. In 2022, the AACN stated that there are no quality metrics to recognize the value of the DNP prepared nurse. How do we continue to implement and expand the number of DNP nurses in the nurse executive leader role? First, we need the support of key stakeholders. Support should come from the top of the organization and include members of the executive team. We also need to gain support from the nurses that will be led by the DNP nurse executive leader. This includes directors, managers, staff nurses, and support staff. Another group to consider is the members of the community, including community leaders and patients. We can gain support by educating our colleagues and community on the value of the DNP prepared nurse. We also need stakeholders to understand the financial impact a DNP nurse executive leader can have on the healthcare organization and the community. The financial benefits a DNP prepared nurse can provide will likely outweigh the costs associated with their employment. As the United States continues to move to a pay-for-performance system, the DNP nurse executive leader has the qualities needed to ensure their organization is meeting quality metrics in order to receive payment and to avoid penalization. We also need continued advocacy from our current DNP leaders. In summary, the DNP Nurse Executive Leader is well positioned to lead nurses and organizations to success. They have the capabilities to be experts in evidence-based practice, leadership, quality improvement, business principles, communication, collaboration, and systems and organizational thinking. DNP nurses deserve a seat at the table, and the role of the Nurse Executive Leader provides that. Having a nurse executive leader with a DNP degree can ensure that nurses are being understood and their needs are being addressed, all while ensuring the vision, mission, and financial goals of the healthcare organizations are being achieved. As the specific roles of the DNP prepared nurse continue to evolve, DNP nurse executive leaders will become more prominent in the healthcare organizations, leading their organizations to success and continuing to transform healthcare. Here's a list of my references. Again, thank you for reviewing my presentation. I look forward to hearing your insight and answer any questions you may have on this role.